I would say that patients come to us primarily for 2 or 3 different factors. We're very honest. We have a written price sheet, which many places don't have.
And I've done my homework. I mean, I'm the kind of guy that really did my homework, so I looked at a lot of centers. What really drew me to Dr. Chin's office is there's so many people out there that advertise, and you see the advertisements as low as $490 an eye.
Unfortunately, some of our competitors here in New York, they engage in forms of advertising that aren't truly ethical. CBS Television did hidden camera with 2 or 3 centers here in New York, and we were the only center that actually told them the correct price.
If you are considering LASIK eye surgery, you had better read the fine print.
And Dr. David Marks is here right now with a warning for us. David.
Well, Ernie and Roz, many eye doctors do LASIK surgery. A few even advertise. But a CBS 2 medical investigation reveals in some ads you may see something that you may not get. The ads are everywhere. LASIK eye surgery for as low as $3.99 an eye. But is it true? Manhattan eye surgeon Dr. Emil Chin thinks these marketing practices are unethical.
That's always a bait and switch because the procedure costs more than that to perform. Okay, so no center is really going to be performing surgery for that price because they would obviously go out of business.
A lot of these mills are really obsessed with the bottom line. They want to keep their costs down.
You're looking at how much money they can make at a particular time while maintaining lower costs of care. Whereas here we're looking more at what's the best possible outcome for our patients.
And it's very hard to put your eyes in the hands of someone whom you don't trust. So we're very good about making sure that we're very upfront and honest with all our patients. We're really very accessible to the public and the only laser center in New York that's on the ground floor and has ground floor access. People can see exactly what we do. I'm hoping that, during their lunch hour they see somebody walk in and walk out free from glasses and contacts forever. Once people view the procedure, almost everybody's so relaxed, they say, wow, I can open my eyes for 1 minute, I could put up with 15 seconds of laser, and they wind up getting it done, and I think that's really a great thing.
From the time that you arrive to the front desk, our practice manager and MD with several years of experience is going to be with you to know what you do, what you want, and what are your goals.
We always take that extra step to make sure that all of the preoperatory tests are normal prior to taking you to the operating room. There's some practices that will take you right away without any preparation.
If you want individual care, where I'm really standing for you as a person and as a patient, I really do think that that's something unusual that we provide. It's about seeing your patients post-op and taking care of them. And patients do appreciate that, and a lot of times they'll bring like a little gift to the office, like some food, maybe a bottle of wine if they're seeing better than 20/20. And it's really rewarding. At this point, I'm making more than half of my patients better than 20/20.
I can see everything. I can just see, period, and I don't have to worry about glasses. I wake up, I go. There's no, it's like I never had a problem. It's really, to me, it's bizarre.
Well, Sarah was an early patient. I operated on her almost 5 years ago, I believe. And I remember she was moderately nearsighted with some astigmatism.
When I think back, I didn't know anything about it, and everybody was saying, don't do it, da-da-da, you don't know, and da-da-da, so forth and so on, and I just kept going back and forth. I was scared out of my wits.
I want my mommy. I'm scared. I'm really scared.
She was a little bit nervous, but we gave her some Valium, and that really relaxed her.
Valium was the best thing. My mind stopped spinning of being scared, and I could literally just relax and follow instructions. The thing I loved about Dr. Chin was that he took me step by step through the whole procedure, literally every second.
Her procedure went very well. She was a very good patient, and afterwards I remember when she could see the clock in the operating room, something she hadn't been able to see for years. She was really happy, and she gave me a big smile, and she also gave me a big hug. So Sarah's a very sweet girl, and I really enjoy helping people like her out. We've stayed friends, and sometimes we get together socially, like she likes playing with my dog.
I have nothing bad to say, just do it.